Bismillahirrahmanirrahim. Assalamu alaikum. I have been asked that what the patients with metabolic syndrome should do during Eid-ul-Adha. So today we shall discuss Eid-ul-Adha in patients with metabolic syndrome. Eid-ul-Adha celebrations may impact patients with metabolic syndrome in various ways. Considerations for these patients include: first, fatty food consumption. Traditional Eid foods can exacerbate metabolic syndrome symptoms. Patients should opt for healthier options. Next comes physical activity. Regular physical activity like walking is recommended, but excessive exertion should be avoided. Then comes the medication adherence. Patients must maintain their medication schedules and dosages even during celebrations. Then comes the blood sugar control. Patients with metabolic syndrome and diabetes should closely monitor their blood sugar levels. Another important consideration is that of hydration. Adequate hydration is crucial, especially during festivities. Patients should drink plenty of water and limit sugary drinks. Another important consideration is portion control. Patients should practice portion control and avoid overeating, which can worsen metabolic syndrome symptoms. Another point is awareness and support. Family and friends should be aware of the patient's condition and offer support and encouragement throughout the celebrations. And last comes medical advice. Patients should consult their healthcare provider for personalized guidance on managing their metabolic syndrome during Eid-ul-Adha. Thank you.